MedCram.com.
Welcome to another MedCram COVID-19 update. Now, there have been a lot of studies looking at the U.S. population and what has happened over the last year in terms of what proportion of the population has experienced mortality from COVID-19. And of course, there's also non-COVID-19 mortality occurring as well. And during the vaccine campaign, we've had a number of vaccines, such as Pfizer, Moderna, and the Johnson & Johnson vaccine, which, according to a number of studies, have reduced infections, hospitalizations, and even death from COVID-19. A question that really hasn't been answered up to this point, however, is what is the effect of the vaccines on non-COVID-19 mortality? This question has been raised a number of times indirectly as to the question of, yes, these vaccines may be preventing COVID-19 mortality because they reduce hospitalizations and infections, but if they're causing significant side effects, is it possible that these vaccines could be potentially increasing non-COVID-19 mortality? As of September 21 of 2021, there have been 182 million people that have been fully vaccinated in the United States, either from the Pfizer-BioNTech vaccine, the Moderna vaccine, or the Johnson & Johnson vaccine. Is there any data that answers the question as to what these vaccines are doing to non-COVID-19 mortality in different populations? And for the first time, we actually have some data that has just been published on October 22nd, 2021 from the CDC in an article titled COVID-19 Vaccination and Non-COVID-19 Mortality Risk. 7 integrated healthcare organizations, United States, December 14, 2020 to July 31st, 2021. So what this study did is it looked at 7 different integrated healthcare organizations. And these integrated institutions are outpatient clinics or hospital organizations, typically with an electronic medical record to track the patients, and looked at a total of about 11 million subjects in this study. So this is a fairly large study. Actually, it was about 3% of the entire United States population. So it's a very robust study in terms of numbers. And it looked at the folks that had the Pfizer vaccine, and there was about 3.5 million with controls. And remember, controls are simply the group that we're comparing the intervention to, and we'll talk a little bit more about that. It looked at those who had the Moderna vaccine, and there was about 2.6 million of those. And then finally, it looked at those with the Johnson & Johnson vaccine, and there was about 342,000 of those with controls. So one of the things about the J&J vaccine is because it was given emergency use authorization months after the Pfizer and Moderna vaccines were given emergency use authorization, they had to come up with different control groups. So they wanted to make sure that the controls that they matched with each of these vaccines were contemporaneous or at the same time that these J&J and Pfizer and Moderna vaccines were rolled out. Now, the other thing that you should understand is that whenever you're doing a comparison in this type of a situation and you're looking at vaccines, people who take vaccines don't typically also engage in risky behavior. And that, of course, could lead to non-COVID mortality. They wanted to make sure that they had the same type of people in the control groups. And so one of the entry criteria to become a control in this study was that they have had to have taken the flu vaccine at least once in the last 2 years. This would eliminate those people that never would have had a vaccine just because of their typical behavior. And of course, the endpoint in this study was non-COVID related deaths. This is important because there's a conception out there that the vaccines may be reducing deaths from COVID-19, reducing infections, but they may be causing side effects that could be causing increases in other things, or maybe even deaths that aren't related to COVID, non-COVID related deaths, in other words. And so that's why this study is really important. So we're going to get through the data. We're going to talk about some of the confounders and some of the limitations of the study. But I want you to stick with me as we go through this, because this is really an important topic to tackle in terms of the reported deaths on the VA-ERS and other things as well. And as a spoiler alert, we're going to see here that non-COVID related deaths are actually lower in the vaccine groups. And we're going to talk about how they did that. And for that, they looked into 7 integrated healthcare organizations with something called a VSD, a Vaccine Safety Data Link, which reports not only hospital-related deaths, but also deaths reported to the health plans. One of the other entrance criteria or exclusion criteria is that the death had to be outside of 30 days from either a SARS-CoV-2 test positivity or COVID-19 illness. Okay, and here's some of the data from that table. We're looking at the subjects in these groups, so let's take a look at them just briefly. We have the Pfizer-BioNTech vaccine here, and we have the Moderna vaccine recipients here, and here is the unvaccinated control comparison group in this situation. So total, there was about 3.4 million of the Pfizer-BioNTech participants. There was about 2.6 million Moderna vaccine recipients. And then here is the control group for both of those. Because Janssen rolled out later, there is about 342,000 enrolled in that group. And there was about 1.3 million unvaccinated comparison group that was later on. And now what we have is the age groups of these groups, as we can see here, 12 to 17, 18 to 44, 45 to 64, 65 to 74, and 75 to 84. And you can see here that these are fairly large groups. So for instance, in the 12 to 17 year group, there was 316,000 enrolled in the Pfizer-BioNTech group. And of course, because the Moderna and the Johnson & Johnson vaccine are not given emergency use authorization for the 12 to 17-year-old group, we do not have data for those groups. There was close parity between male and female across the enrollment group, with in the mRNA vaccines there seemed to be a slight predilection for female enrollment, and the opposite in the Janssen pharmaceutical or the Johnson & Johnson vaccine group. And I also want you to notice that with respect to race and ethnicity, this was a pretty well-balanced study with good representation from many ethnic groups. Okay, let's take a look now at the deaths in these groups based on the reporting from our pre-aforementioned criteria. So again, these are deaths that did not occur within a 30-day window of people turning positive for SARS-CoV-2 or COVID-19. Those were excluded because this is non-COVID-19 mortality. And it was reported from the VSD, or the Vaccine Safety Data Link, from 7 very large integrated healthcare organizations representing about 3% of the entire population of the United States, or 11 million. And these are being reported as, in the first number, the total number, and in the parentheses, the standardized mortality rate per 100 person years. And so when you're comparing these groups, it's important to compare the number in the parentheses. And 100 person years is basically the amount of time and the amount of people over which you would see the following data. If you took 100 people for a year, or if you took 1 person for 100 years, or if you had, for instance, 10 people over 10 years of time. This is the amount of deaths you would see with that kind of a denominator. It's just simply a way of normalizing the data. And so here are the results. Again, because the Moderna vaccine was not given emergency use authorization for the 12 to 17-year-old age group, we do not have data for that or for the Johnson & Johnson vaccine. When they do this, they look at what the death rate per 100 person years is after the first dose of the Pfizer-BioNTech, after the second dose, after the Pfizer-BioNTech, after the first dose of the Moderna, after the second dose of the Moderna, and of course after the single dose of the Johnson & Johnson or the Janssen vaccine. And we can see here overall that after the first dose, there's a total of 1,157 deaths, or an adjusted mortality rate per 100 person years of 0.42. And we see here the number after the second dose of the Pfizer-BioNTech. We see here 1,202 after the first dose of the Moderna vaccine, and we see 4,434 after the second dose of the Moderna vaccine. there was 6,660 total deaths in the unvaccinated comparison group, or a standardized mortality rate per 100 person years of 1.11. And in the Johnson & Johnson vaccine recipients, a total of 671 for that. And in the unvaccinated comparison group, 2,219. And so you can see here the breakout for all of the different age groups after the first and second doses of the Pfizer, after the first and second doses of the Moderna, and of course for the unvaccinated comparison group. For the vaccine recipients for Johnson & Johnson, you can see that here with the rest of the age breakdown, and of course for their own control group. Again, they have their own control group because they rolled out later and they wanted to have a control group just for them. So again, just to be clear, the number here is the total number of deaths, and the number in parentheses is the number of deaths per 100 person years. So it gives us a little bit of insight into what is happening according to, again, this is non-COVID mortality. Again, let me repeat this. This is non-COVID mortality. So if we look, for instance, at this unvaccinated group, 12 to 17 years of age, just following these patients along, unfortunately, 7 of these individuals died from something not related to COVID whatsoever. And from the 18 to 44 group, 161 died. In the 45 to 64-year group, 910, and so forth, 1,407, 1,861, and then finally in the greater than 85-year age group, 2,314. That is the unvaccinated comparison group. When we look at the Pfizer and the Moderna vaccine recipients, we can see how many people died from non-COVID related deaths in these groups. These are like coronary artery disease, heart attacks, accidents, strokes, anything but COVID-19. We can see here the difference between male and female, and we can see the difference here in the race and ethnicities. So the point being is once we have this raw data, we can then compare them to each other. So we can compare the Pfizer-BioNTech recipients to the control recipients to see if there is a reduction in non-COVID-19 mortality. And that's exactly what this table is showing. Now, the thing that you have to understand is when you compare two groups to each other, there may be a difference in the average of those two groups depending on what you're measuring. But the question is how do we know that difference is real? We know that that difference is real based on something called a 95% confidence interval. And that's what you're seeing here in these confidence intervals, here, and actually anywhere you see on the page these two brackets, what you're seeing in between them is the range that we believe the real value exists with 95% confidence. Now, because this is a relative risk number, it's important to understand that if this range that you're seeing here in this 95% confidence interval includes the number 1, then you really can't tell whether or not there is an increase or decrease risk at all. In other words, if the range is completely less than 1, as it is here in this first one that we're looking at, 0.38 to 0.44, then that means that the number 1 is outside that range, and we can say that the relative risk here is lower. And so what this would mean is if we look at those people who took the Pfizer-BioNTech vaccine, after dose 1, we could then say that they had a lower mortality, non-COVID-19 mortality, than the control group that was put in this study. After the second dose, it also seems to show that, again, there was a lower relative risk of dying from non-COVID-related causes if the patient got the vaccine. And that went across the board for not just Pfizer-BioNTech, but also Moderna and also the Janssen pharmaceutical product as well. In fact, in all of these confidence intervals, they all did not include the number 1, except for the Pfizer-BioNTech age intervals for those between the ages of 12 and 17. So because of that, we really can't say whether or not the vaccine increased the risk or decreased the risk of non-COVID-19 related illnesses or deaths in this case. But for all other age groups, we can say that there was, based on this statistics, a reduction in non-COVID-19 related mortality in those who took the vaccine. The other thing that's notable is we look at the averages here for the Janssen pharmaceuticals. We see that the numbers here are in the 40s to 50s to 60s, whereas when we look at the Moderna and the Pfizer BioNTech, that those numbers seem to be, generally speaking, in the 20s to 30s. So the question is why would the vaccine cause a reduction in the non-COVID-19 mortality in these recipients? And the thing that you've got to understand is that this is an observational study, so we really can't put together causation here. And secondly, I think the explanation is clear once we read the author's discussion. And I think this paragraph here is very important to read and understand. It states here that in a cohort of 6.4 million COVID-19 vaccinees and 4.6 million demographically similar unvaccinated persons, recipients of the Pfizer, BioNTech, Moderna, or Janssen vaccines had lower non-COVID-19 mortality risk than did the unvaccinated comparison groups. Then they go on to say why they think this is the case. There is no increased risk for mortality among COVID-19 vaccine recipients. That's an important statement to answer the question about whether or not there is an increase in mortality that we're missing in patients who get the vaccine, and we're only measuring COVID-19 related hospitalizations and deaths and seeing a reduction there. So this answers a very important question. Is the vaccine causing deaths elsewhere that we may not be picking up? And again, here is their conclusion that there is no increased risk for mortality among COVID-19 vaccine recipients. But why would it be lower? And they answer this in the next sentence. This finding reinforces the safety profile of currently approved COVID-19 vaccines in the United States. The lower mortality risk after COVID-19 vaccination suggests substantial healthy vaccinee effects, i.e., vaccinated persons tend to be healthier than unvaccinated persons. Here's the key. Even though, as part of the entry criteria for the control group, those subjects had to have had at least one flu shot in the last 2 years, they may not have completely taken care of that confounder, and there may be a healthy vaccinee effect in this population. They do say that they're going to explore that in future analyses. They further go on to state that mortality rates among Janssen vaccine recipients were not as low as those among mRNA vaccine recipients. This finding might be because of differences in risk factors, such as underlying health status and risk behaviors among recipients of mRNA and Janssen vaccines that might also be associated with mortality risk. Now, the authors of this study do state that there are at least 4 limitations of this study. We mentioned this. The study was observational, and of course, there's always going to be confounders at the individual level. Second, that the healthy vaccinee effects were found in all but the youngest age group. They go on further to state that lower rates of non-COVID-19 mortality in vaccinated groups suggest that the COVID-19 vaccinees are inherently healthier or engage in fewer risk behaviors. The third limitation is that even though COVID-19 deaths were excluded, the cause of deaths were actually not assessed. And of course, finally, this was in 3% of the population, and it may not be completely generalizable to the entire U.S. population. However, despite these limitations, the authors felt that this study had several strengths. The first one was that this is a very large cohort that looked at a very wide socio-demographically diverse population, and it also incorporated a study period of greater than 7 months. And secondly, these VSDs, or these vaccine safety data links, were able to assess vaccination records outside of their systems that would normally not happen. Third, the assignment of index dates to the people being vaccinated allowed for the elimination of something called the immortal time bias. So this is basically caused when a cohort study is designed so that the follow-up includes a period of time where the participants in the exposed group cannot experience the outcome of, in this case, death, and so it appears as though they are immortal. And apparently allowing the assignment of these index dates helped prevent that from happening in this study. I think that this study is important to understand because it answers the question about something that a lot of people have asked, and that is, are these vaccines really safe? And I can tell you, for me, who's worked in an intensive care unit during this pandemic early on, And when we were seeing 300,000 to 400,000 daily cases of SARS-CoV-2 in the United States, we were adding patients to an expanded intensive care unit at our hospital. But when that came down and we started to vaccinate 3 to 4 million people a day, we had contracted down our ICU services back to just one ICU. We were hardly seeing any type of admissions for COVID-19, but more specifically to the point of this paper, we weren't seeing increased admissions for unknown causes or for non-COVID-19 causes. And then when the Delta variant hit in July and August, cases spiked once again, and we had to reopen another floor again to contain those patients being admitted to the hospital for COVID-19. So in my own view, I could see that there was a correlation between hospitalization and deaths and the number of COVID-19 cases, but not an association with the amount of vaccination that we were doing in the state and also in the country. And I can tell you personally that all of the patients that I took care of in that intensive care unit during the Delta wave were unvaccinated. It also confirms for me what our thoughts were on the increased amount of reported deaths in the VA ERS system as being a stimulated reporting mechanism. And for those of you who haven't watched our video with Rhonda Patrick going over questions and concerns on vaccines, we address this issue with stimulated reporting in the VA ERS system. Remember at this point here that reports were mandated to be made if there was any sort of death, even if the reporter of the death did not think that the death was related to the vaccine. We also showed in the article that was published by Morrow that there was, during the 2009 to 2010 season, a very high level of reporting that occurred alongside with the fact that there was a lot of vaccination coverage that year. However, even though the vaccine coverage remained high, the amount of reports dropped down considerably. And this was shown to be likely because of the amount of interest in the H1N1 virus in 2009 and 2010. As you can see here, that the amount of interest as measured on Google Trends seems to have the same shape as the reporting as well. And this led the authors of that study to conclude that the peak in the number of pregnancy reports observed during the 2009 and 2010 year, followed by a decrease in reporting, suggests that the 2009 spike in pregnancy reports after 2009 H1N1 inactivated vaccines may have been due to stimulated reporting. And of course, today, if you were to Google Trend the COVID vaccine, you would see a very similar increase in reporting along with the interest in the vaccine. And earlier this year, we did a calculation that showed that in the United States, typically, in any 100,000 people over a year period of time, there's about 869.7 people that die as an average. And then if we looked over the 7-month period of vaccination that we had done at that time, there was 166 million people at that time that were vaccinated. And over a 7-month period of time, that would give us an average of 3.5 months. Over a 12-month proration, we came up to a number of about 421,000 people that should have been dead just based on chance alone at getting this many vaccinations. And so at the time, there was much less than that. And we believe that that was related to significant underreporting, but we couldn't be absolutely sure without further data. I believe that this paper has given us the data points that have enabled us to make that assessment with more confidence. Please look in the description below for the link to this article. Tell us what you think. Thanks for joining us, and don't forget to follow us at medcram.com.